Okay, good afternoon, good morning. How are you? This is Dr. Gombele from drg.com. Happy Valentine. We are talking to you from Kingston, Jamaica, the Caribbean. Buenas tardes, buenas noches, depende de donde se encuentra. Mi nombre es Dr. Gombele de drg.com. Bon après-midi, bonne nuit, bonjour, ça dépend de quel pays tu te trouves. Je m'appelle Dr. Gombele de drg.com. Alors aujourd'hui, c'est une émission spéciale seulement pour vous, mes membres, mon équipe sur YouTube. We say that today we're going to have a conversation on what we had posted last week on our YouTube channel. I would really like to thank you for supporting us. This is our 5th week, and we already have 302 subscribers. We came in YouTube to stay. How do we stay? Depend on you to share, to like, to subscribe, so that we can expand. We are hitting 1,000 subscribers in May, so we don't want to miss that. Like, share, subscribe, and you click the notification bell so that as soon as we upload our new videos, you will be notified. So, my name again is Dr. Gombele. I'm going to start by answering some questions that some of you put at the end of the video, or they did WhatsApp me, so that we know where we stand, all right? So there's a link there. Those who want to come alive, you click the link and we're going to see your face. If you're shy, you can still write, and gladly we will answer to your question. 302, we thank you for subscribing, and we are not going to let you down. You will be educated, inspired, and motivated in this YouTube channel. Somebody asked me a question. What is the difference between glucose and insulin? Okay. What is the difference between glucose and insulin? And in my language back home, we say that there is no full question. All questions should be addressed. All right. So the person is asking, what is the difference between insulin and glucose? Glucose is the end product of starch. Starch consists of bread, rice, pumpkin, yam, cassava, all the carbohydrate that we eat. When we consume them, then they break down to sugar in the blood. And the medical terminology for sugar is glucose, right? And then it gets stuck in the blood, of course, within the arteries, which are vessels. For the sugar to leave the arteries to get to the body now, to the muscle, to the meat aspect of us, we need insulin. And insulin is a hormone that is produced by pancreas. Pancreas is a gland situated in the abdominal cavity. When it's produced, it goes straight to the bloodstream, and then it opens the doors so that the sugar can exit and get into the body. How does pancreas produce the insulin? When there is a spike of glucose, of sugar in the bloodstream, the brain picks up the spike And because the brain is the master organ, then instructs the pancreas to produce more insulin. And then when pancreas produces insulin, then the insulin is released to the bloodstream so that it can help to open the doors within the vessel so that the sugar can exit the vessel, get into the body so that it can be used as a source of energy. All right, so that's question number one that we answer. Glucose is sugar from the food. Pancreas is hormone. Insulin is a hormone produced from the pancreas, and it is produced when there is a spike of sugar within the vessel that the brain, which is the master organ, captures or picks it up and instructs the pancreas to produce insulin. I see another question here. Walter in Old Harbor, Jamaica. Diabetes runs in my family. How can I lessen my risk of getting the disease? We have said this over and over, and we will continue saying this over and over. Keep your weight down, okay? Eat complex starch, food from the ground, green banana, yam, pumpkin, cassava, dashing, but also eat them in moderation, right? Exercise every other day. Educate yourself, all right? And then in our previous presentation, we say that how do you eat? This is a plate. You divide the plate in two. 50% of the plate should be like vegetables. The other 50% you divide in two. 25 protein and 25 starch, but good starch. All right. And then for those who are not diabetics, but with the family history of the disease, family history meaning your father, your brother, your cousin has diabetes, you can check yearly. All right. You check yearly for diabetes. If you do just that, you may not have the disease. And if you do have, maybe when you are 110 years old. All right. So keep your weight down, exercise, stay away from refined stuff, cut cut down on the use of added sugar, drink more water, and then you will stay far away from diabetes. Why weight management becomes vital in this case? Because even though you have the family history or not, being overweight or obese puts you at a higher risk of developing diabetes than a slim person with the family history of diabetes. Okay? Question number two that I have here to answer, it's on gestational diabetes. All right? And there's a person who has asked if gestational diabetes is reversible. Oh, yes, it is. In fact, naturally, after you have had the baby, gestational diabetes, gestation is pregnancy, is a diabetes that is caused by pregnancy to a lady who previously was no diabetic, right? So you get pregnant, and due to the hormones that change during pregnancy, you develop insulin resistance, which is in fact type 2 diabetes. All right. So what happened now? After you deliver the baby, the changes that occurred during pregnancy subside. And then you go back to normal. But listen to the bad news. The bad news is that almost all the ladies with gestational diabetes develop a higher risk of becoming diabetic in 5 or 6 years. So if you become free of diabetes after pregnancy, then you join a group of people now who want to stay free of diabetes. Then they exercise, they eat right, they check their sugar yearly. Now, if you have a gestational diabetes, you can check it twice a year, right? You eat right, you exercise, cut out of the sugar, refined product, and then you will be quite fine. Now, when we say that you reverse, that's not a final cure. You reverse because you adopt a different lifestyle. But if you go back to the lifestyle that has led you to the disease, unfortunately, though, the disease will find you wherever you are, right? Somebody say, what are there? What are the different types of diabetes? We say that in my book, I have discussed 5. Diabetes type 1 in children consists of 5 to 10% of all diabetics, right? Or diabetes patient population. In this type, treatment is insulin, but still, diet and exercise can really minimize the amount of insulin you will need, all right? Because we said earlier that it's the food that we eat that what? Spike the sugar. Okay, so the sugar gets spiked high and your pancreas cannot produce insulin, so you have to get more insulin. And the insulin you get through injection depend on how high is your blood sugar. And we said earlier, how high is your blood sugar depend on what? On what you consume. And we said also that 1.5 type diabetes is nothing else than diabetes type 1 diagnosed within the adult populations. Okay? And we said also that type 1.5 diabetes mellitus, it consists of maybe 20 to 40% of type 2 diabetes because it is diagnosed in adult, and sometimes we just jump into the conclusion that it must be type 2 diabetes. But as time goes by, they don't do well on oral medications. So we'll have to switch them into insulin. And when we do other type of tests, we realize that it is autoimmune diabetes. And then also we had said that there is type 2 diabetes, which is a lifestyle disease. And we say, thank God, because it's the most prevalent and the most manageable one of all the diabetes, because if you change your lifestyle, subsequently, you will also reverse the disease. The reversal is not permanent. As long as you stick to the diet, it will be permanent. But the time you go back to the food, to the lifestyle that has led you to diabetes, it will also come back. And we also say there's gestational diabetes, which is a diabetes that is caused, as I indicated earlier, by pregnancy. That's 4 and 5, and the last is drug-induced diabetes. This is funny enough. This is medicine, you know. You treat one thing with a specific medication and you get good result for that medication. Unfortunately, though, the side effect of that medication among them is what? Type 2 diabetes. And sometimes we have to see what is good from what is bad, the pro and the. We will use the medication and we prefer to treat the diabetes than to stop giving the medication. And prednisone is one of those examples. It's very good for lupus, very good for all the autoimmune disease. But when we give prednisone and you develop diabetes, you know what? We're still going to treat the diabetes and we're going to continue with the prednisone. Okay? So that's diabetes, drug-induced diabetes. So I'm sharing this good news to all of our friends on Facebook, and I want to share it with you also on YouTube. What is the good news? The good news is that I saw a young girl, a high school student last year. She was overly obese. The weight was 219. She was maybe 5.6, 5 feet 6 inches. So I sent her to do the ultrasound. The report came back to me positive with what? Polycystic ovarian syndrome. She saw a period once every 3 months. Now, to a young girl, it does something to her. I explained to her, I put her on diet. She came 2, 3 times, and I never saw her again. I was sharing my videos. Luckily, I sent it to her. And quickly, she responded, "Hi, Dr. Gombele." I said, "Hello, she gave her name. I said, "Well, I have so many patients, I don't remember the name. She called the name of the school that you did put on her diet." I said, "Oh, really? So what happened to the diet?" "I have lost 65 pounds. I said, "Oh, really?" I said, "Yes. Send me a picture." But she was reluctant to send me a picture. I said, "But I'm having a live stream conversation tomorrow. Can you join us?" I sent her an invitation, but I didn't see the response. But she was excited to tell me that she has lost 65 pounds. That means from 290, now her weight is 155, 54. Seeing her periods regularly. This is not the first. I've done that before with many other girls. But what struck me here is the length of the time. It's like 1 year or 15 months, right? So I tell people one thing: in trying to reverse your diabetes mellitus type 2, or trying to reverse any disease that you have, do not be in a hurry. There will be no quick fix. It takes time, right? And this girl just proved it. 1 year and she lost 65 pounds. All right. So if you divide 65, all right, let's say it took her 15 months. All right. And then now you divide 65, right, by 15. I'm going to do it. I divide 65. Oh, what I'm saying, 65 by 15. So she lost 4 pounds every month, right? 4 pounds, slowly but surely. At the end of 15 months, she lost a total of 65 pounds. So if she has lost 4 pounds per month, that can send us to say safely that she's losing what? 1 pound every week, because a month has 4 weeks, right? So to say, right? But if you tell somebody, "Well, I lose 1 pound every week," I say, "Oh, really? I want to lose maybe 3 to move fast." But it's not the beginning that counts in these things, it's the end. You lose 1 pound every week, it is 4 pounds every month, and then it is what? 65 pounds in 15 months. So I'm happy that this girl can now see her periods regularly. I know she likes the way she looks. That's the first thing they tell me. I help one and she started taking selfie. She came to me and said, "Doc, we're going to take selfie." She was like 16. It's because she liked the way she looked, she moved fast, the clothes fit, all kind of things that a typical young girl will like. All right, so the program works. All right, less refined food, more vegetables, exercise, and you will lose weight. So we are going to invite you now to go to, these are our customers already, our members are registered already. So for them to have been registered, they know what to do. They went and click the button and register. So we're just asking you to share the videos, because the more you share, more subscribers we will get. We want to hit 1,000 in May, right? And we depend on you, right? You are faithful subscribers. share the videos, share the news. If you have a friend, a family member, a colleague, an associate, send a video to them, right? And then invite them to subscribe. And most of them, they don't know, tell them on my left, below, on their right, they have to click, or they can go on YouTube. And most of them are saying, do you have a YouTube link? What is your YouTube channel? This channel is my name. Dr. Gombele is the address of the channel. Put Dr. Gombele in the bars, punch, you're going to see the channel. As simple as that. There is no other link, there is no other address, just Dr. Gombele, Gombele. And then you're going to see the videos, and then you tell them that they can choose. So far, we have 5 videos, and we have 302 subscribed. So we are happy about it. We are moving forward. So we're inviting you now to spread the news so that we can hit our 1,000 mark in May. No less than that. We don't want to go to June, May, to June, July. No, May, we want to hit our goal. And you are going to see it's going to be a transformed society. I can click on it. Is people waiting? No, not yet. Okay. So when we create a community of diabetics or health enthusiasts, it's going to be very easy for us to communicate, right? So spread the news and then invite them to subscribe so that they can enjoy what you are enjoying. So we are streaming live. We invite you to ask questions, to participate, right? To get depth in any of the videos that you have viewed so far. If you have a concern, I'm going to be here. I have what? I have 20 more minutes to go. No, it's more 35. I have 35 more minutes to go. I will be more than glad to answer your question, because the last video we posted, it's moving very fast, right? So I decided to go over that video. The name of the video was Top 10 Mistakes That Diabetes Do. All right? Top 10 mistakes that diabetes do. And of course, those mistakes affect their diabetes control. All right? These mistakes, I didn't pick them up from a book or from a magazine. These mistakes, I collected them from my interactions with various or numerous diabetics during my 20 years of dealing with diabetes. I see people on my private office, and I see people at ER, and I work in one of the busiest ER in the Anglophone Caribbean. I think it's the oldest one too. So I know what I'm talking about. Those who didn't listen to my advice, in my office, they come at ER out of it. The machine cannot read, the infection went worse, coma, they cannot respond, the sugar went low or high, right? So I collected this information when I talked to them. I said, what happened? How do you do? How do you manage your diabetes? What is it that you do that I can help? And the mistake number one that some of them, and high proportion of them, high percentage of them tell me, is that they did not accept the diagnosis. Okay? They did not accept the diagnosis. That means they denied the diagnosis. When it's borderline, you go to the doctor says, no, you have borderline diabetes. Sometimes we don't even have symptoms. But the doctor says, okay, maybe you have to do a change of lifestyle, or I can put you on metformin. They say, no. I know I'm going to do my things and I'm going to do home remedy, and they go home and they drink this bush, they drink that bush. Well, I believe in the healing power of the herbs, but you must know what you're doing, right? Not all greens are good for diabetes, right? You must really know what you're doing. In addition to greens, you need what? Education, you need what? Exercise, right? So, and then after a while doing the things, they go back to eating things that led them to the same problem, all right? And when they cannot handle, the machine cannot read, the infection is very high, severely dehydrated, the mouth become dry, they drink a lot, they go to the bathroom 20, 30, 40 times a day to urinate, then they come to the doctor. Do not deny the diagnosis, but deny what? The prognosis. Challenge the prognosis, right? You say, I'm not going to lose my eyes. Even though they say diabetes is the leading cause of the erectile dysfunction, I'm not going to lose all my erections. You're a young man, 35, 40. And you say, what am I going to do so I don't lose my erection? Keep the sugar under control, lose your weight, exercise, and be educated. Where? In this YouTube channel. So you subscribe and you're going to be educated, motivated, and inspired. Again, the link for the channel is Dr. Gombele. Full stop. And Gombele is spelled Gombele. Only one Gombele in the whole Caribbean. No, myself, my wife, and my 2 children. Right? So you just do that. Mistake number 2 they do. I don't know where they learned this. When they read the sugar in the morning, right? And they see it's high, they double the medication. That's not the right approach. You must know why the sugar is high. I can tell you, seeing your period can affect your sugar. Not sleeping can affect your sugar. Simple coughing excessively can affect your sugar. Stress can affect your sugar. And under normal circumstances, food is the most that can affect your sugar. Then you ask yourself, what is there that can affect my blood sugar? Right? Is that the sweet potato I ate? Is that the Irish potato I ate? Is that rice I ate? Cassava I ate? Bread? Cornmeal porridge? Cereal? Too much ketchup? Too much dressing salad? So all these can affect your sugar, right? Than just doubling the medication. That's not the right approach. Mistake number 3, exercise and take your medication, you will be okay. No, exercise alone and medication are not good enough to help you to control your diabetes. You must add some kind of diet, right? You must add some kind of diet for you to be able to control your sugar. I see a question here by Karen asking, my friend has excess belly fat. Should she be concerned? Yes. Yeah, because the excess belly fat We call it what? Central obesity. A central obesity is one of the reasons people will develop diabetes, or we also call it what? Wheat belly, right? So, and then, as I said earlier, that obesity is the single strong risk factor for diabetes. So there's a reason for concern, Karen. So you should advise your friend to subscribe to my YouTube channel, even though she's not diabetic, but she can learn how to lose weight, to eat properly, and then she will lose belly and she will be healthy, right? So the mistake that diabetes do, number 4, eat everything as long as they take their medication. And this mistake comes from us. I've asked patients over and over, and they will tell me that my doctor told me to eat everything as long as I take my medication. I said, well, that's why you are today in the hospital, because the sugar is high. It never worked in the past. It doesn't work today. It will not work in the future. You must eat certain things and do not eat others, because not all the things you eat are diabetes friendly, right? So you should eat from the farm, stay away from the refined, highly processed food, eat a lot of vegetable, exercise, drink water, and then you will be surprised to see how your sugar or glucose will go down. Mistake number 5. They believe in only treating symptoms, right? They have itching somewhere. They come to me and they say, Dr. Gombele, I'm itching. I say, okay. Or I have a blurry vision. I don't know what I can do. Or I'm feeling weak. And then when I check, the sugar is high. And they say, but what do you think? Your sugar is high. Oh, no, it's always high. I'm okay. You can't be okay when the sugar is high. The sugar high is responsible for long-term complications, which are those: amputation, stroke, heart attack, kidney failure, right? So you need to do something about that. When the sugar goes down, the vision comes back, the itching disappears, the mouth becomes wet, because too much sugar leads to also dehydration. Mistake number 6, they never make a connection between the elevation of glucose in their blood with the food they eat. Can you imagine? In fact, the most frequently asked question among diabetes is what to eat. Yes, I think we're not doing the right job. We doctors, nurses, pharmacists, all the health professionals, we're not doing a good job. What to eat is the most frequently asked question among diabetes patients. They do not know what to eat. So if they do not know what to eat, I'm not surprised if they just cannot make the connection between the food they eat and the sugar. In this channel, we will say it as is. We will tell you exactly what to eat and what not to eat. But having knowledge alone is good, but not good enough, because if you don't apply the knowledge, then the result will not happen. All right? So when my patients call me and they say, Doc, the sugar is very high. And I say, oh, really? And I say, what did you eat? They know already. He said, Doc, the sugar is very high, but I ate sweet potato. I said, but did you see sweet potato in my program? No. I ate pasta. Did you see pasta in my program? No. I ate cereal in the morning. Did you see cereal in my program? No. I consumed cornmeal porridge this morning. Did you see cornmeal in my program? No. I ate dumpling for lunch. Did you see dumplings in my program? No. Okay? So they are used already. Before they call me, they have to put down what they have eaten, and we're going to go through what they had eaten previous day, and we can see if really is that. And most of the time it is. Most of the time it is, right? So you must make always the connection between the food that you eat and the elevation of your blood sugar. Diabetes patient, they fail to be an active participant in the treatment of the disease. What do I mean by that? I mean they rely too heavily on doctors. They go to the doctor, they check their pressure, they check their blood glucose, that's it. But I ask question, how often do they go to the doctor? Once every 3 months. So after they leave the doctor office, what next? They have to check their sugar twice a week. They have to check their weight. They have to be careful on what they eat. They must know what to eat and what not to eat. All right? So they must be a part of the solution. All right? Don't depend heavily to the doctor. You must know something, and when you go to your doctor, you can have a very constructive conversation that will help your doctor to help you to cut down on some medication, or unfortunately to do what? To increase your medication. Mistake number 8. They fail to record what they eat. And I understand now why they fail, because they don't know what type of food that will affect their diet. But there's something here now. Ignorance isn't an excuse to the consequences. Not knowing is just not exemption. Sadly, though, knowing, not applying, not knowing, they pay the same consequences that have seen over and over and over. You want to know what the consequences are? Amputation, strokes, heart attacks, early erectile dysfunctions, kidney failure, blindness, and you can name it, right? These are the consequences. But if the sugar or the blood glucose is controlled, you can live a normal life. Right? Normal life. Maybe something else can kill you, accident or something else, but you can live a normal life. So record what you eat, huh? Record what you eat, and be able to have a constructive discussion, conversation with your doctor. When you call, my sugar is high, right? Now is a Valentine's Day. Try to eat good, huh? Good food, healthy food. Do not indulge too much, because what we realize after Valentine's Day, the ER of most of the hospital with gastroenteritis, they indulge. After New Year's and Christmas, January, the accident emergencies of most hospitals are full with patients. You know, the pressure high, the sugar high, infected wounds, because people just indulge. You know, have a good time and enjoy healthy food, and then you will be all right. Mistake number 9. We're going down now. They fail to be a part of a diabetic support group. Dr. Gombele channel is a support group in the making. Already we have 300 registered members. So this is a support group that we have already, right? So they drop their questions, and from time to time, I answer them right there. Or this is an opportunity to interact, so they can ask questions and I can answer. Support group helps. You're going to find many people with your condition. You're going to find some are always better than others and they can help you. Their sugar is always under control. And you can ask them, what is wrong I'm doing that they're not doing? They exercise, they eat less. Last meal maybe 7 p.m. I'm in a group where somebody wrote, what can I do for my fasting? My fastings are always high. Fasting is the blood test that you do early in the morning before you eat. And then another member who is a diabetic say, watch out because you eat late. Okay? You eat late. But it's more than eating late. Because guess what? When it's dark, it's night, right? The brain picks up and then your body starts slowing down. And the brain will think you are going to rest and you are sleeping. You are going into fasting for at least 8 hours. The sugar that is kept in liver in the form of glucogen, the liver now starts releasing that sugar in your system so that you don't go hypoglycemic, right? The liver starts releasing the sugar. Too much starch is kept as sugar. Too much fat too is kept in the liver as sugar, right? But if you had a heavy meal, that means your glucose level will be what? High. To add up also with the sugar that the liver will be releasing during the night. That's what affects your fasting blood sugar. So you want to have a normal fasting blood sugar, the first thing you need to do is do not eat late. One, and the last meal of the day must be very light. And then you're going to have the result of having a normal fasting blood sugar, right? So mistake number 9, they fail to be a part of a diabetic support group, right? Mistake number 10, the last but not the least, and maybe the most important of the 10, because I read an article written by Dr. Dalip Raghuborsin, a lecturer at the University of the West Indies in the Faculty of Medical Sciences. He says that the Caribbean is becoming the world capital for foot amputations. Can you imagine? And the saddest part is that 85% of all the amputations could have been what? Avoided. Right? So it comes down to clarify that ignoring the foot care is a big problem within diabetics because it will lead to infected wound. Infected wound will lead to the gangrene. That's when the soft tissue is dead or died. So the result here is what? For the surgeon to amputate. It starts very simple. a bruise between the toes. Because you're delinquent diabetic and your sugar is high, your nerve become affected. Your nerves become affected. When you bump something, you don't feel the pain. And you have a bruise there, you don't feel that there is a pain, there is a bruise. And then now the germs get into the skin because it's a broken skin, get infected. And then you feel like something wet between your toes. When you look, there is a cut. And you look, there is a discoloration of the toe. And you come to ER and examine the toe is fluctuant. When a squeeze, pus comes out, you have to go and admit. Sometimes we save the toe, and many times they have to amputate the toe. Or you stay at home, you start watching it, putting some stuff, and the infection leave the toe, get to the ankle, right? By the time you come to A&E, accident emergency, the whole foot is infected, right? And then when the infection reach the ankle, they don't have to cut to the ankle. They have to go way up to find a healthy spot so that when they amputate there, that healthy spot will heal, right? For a simple thing that could have been what? Prevented. Okay, Dr. Gombele, how do we take care of our foot? Number one, you wash the foot. Number two, do not allow the foot to be too dry. You use a lotion to moisture the foot. You dry between the toe and you use the lotion. Number three, examination. You have to look. If you cannot reach down as many people, you put a glass or mirror somewhere there, you look. Or you call your wife or your children to look between the toe. Take a picture and let me see. Take a picture, send to your friend who's a nurse or a member who knows something about that. Number three, the shoes that you wear must not be tight. The socks that you use must be cotton. That will not lead to the sweating between the toes. And never wear shoes without a socks, because the shoe will rub on the toe and then it will develop an abrasion. And the abrasion, as we said earlier, can lead to a serious problem and then go to the amputation. All right? So foot care is important. Unfortunately, many diabetes patients ignore the foot care, right? And most of the amputations could have been avoided. But the thing about amputation, though, is that most of the patients with amputation die within 5 years. Within 5 years. They don't really die from amputation. They die maybe from depression, right? And now when you amputate it up to the knee, that means you have one foot to bear the weight of your body. And most of the time, the same foot gets sick. Huh? And when you get bilateral, I mean amputation on both sides, that's even worse, right? And you feel they fall from the bed because they still think they have the foot and they want to get up and they fall. And sometimes they fall on the same foot, that the same wound they're trying to heal. So it just makes the whole situation complicated. And if you don't have a good family support, it's going to be a problem. You are the father of the family. You are the brain, the bread winner of the family. And you cannot work. You cannot work, you cannot walk, you have to depend on people. Not a pretty scenario. So what happened is that most of them die from depression, right? For a simple thing that could have been what? Avoided. Okay? So these are the 10 mistakes that most diabetes patients do. And avoiding these mistakes means good diabetes control, good health, less amputations. And another way to prevent amputation is exercise, because exercise help the blood circulation in the foot, right? And the more important also is what? To keep your sugar under control. Fluctuation of the sugar reading is the most important risk factor for long-term complications, which we have said: heart attack, stroke, erectile dysfunction, amputation, blindness, all kind of things, end-stage renal disease, right? So you have to keep your sugar under control. Okay, so this is what we have been saying, that we need to control diabetes, we need to join uh, a support group, we need to know what to eat, how to eat, when even to eat, right? So that we can be healthy, right? So we thank you for subscribing to the channel, and we depend on you to go and invite more subscribers. We want to hit May with 1,000 subscribers, and then it will change the way we communicate. We are going to become a community of people. So interaction will be very direct and very easy. All right. So I hope we have said everything. How many more minutes have to go?
8 minutes.
8 minutes, yes. So I think we said it all. And then we want to thank you again. We want to thank our technical director for the work he has been doing. We are going on. We came to YouTube to stay. We are going to stay right here. We are not going anywhere. In May, we are going to hit 1,000 subscriptions, right? For the work he has been doing. The photographer, Yamalu, great job. The person who edit my script, great job, Karen. And then now the technical director will come and do the editing, and the color, adding the designs, cutting the word short, putting them in the way that can facilitate the learning. It's a great job. So, team, we are targeting 1,000 in May, not June, not July, May. You have helped us not to have 302. And I know at the end of the program, if we check, we may go to 310. We have 1 year content, no stop. All the content are alike, very, very informative. So be safe, be good to yourself, right? Do whatever we are telling you to do, learn more, be a help to somebody else. And if you're not a diabetic, you can still learn to help a family member or a person is under your watch. It was glad chatting with you guys. It's good to be on YouTube as long as we want to be there. So you can still go and view in extended manner, 10 mistakes that most diabetics do. Right? So, salam alaikum. Au revoir. Mbote tikalamalamu. Hasta luego. God bless you. Until next time. Bye-bye. Here again.